You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a new patient. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning. May I know your name and age, please?
Good morning, doctor. My name is Sarah, and I am 28 years old.
Nice to meet you, Sarah. What brings you to the hospital today?
I injured my finger while playing basketball, and I think I have a problem with my nail.
I see. Do you have any past medical history, or have you had any surgeries before?
No, I don't have any past medical history or surgeries.
Okay, thank you. And what about your family's medical history? Have any of your family members had any illnesses or medical conditions?
Yes, my mother has diabetes, and my father had a heart attack a few years ago.
Thank you for letting me know. Have you ever had any allergies or reactions to medications before?
No, I haven't had any allergies or reactions to medications.
Great. Can you please describe the symptoms you're experiencing with your finger, and when did they start?
My finger is swollen and it hurts when I touch it. The pain started yesterday after I played basketball.
Okay, let me take a look at your finger. Your vital signs look normal. The swelling and discoloration under your nail is consistent with a subungual hematoma.
What does that mean, doctor?
A subungual hematoma is a collection of blood under the nail, which can be caused by an injury to the nail. It can be quite painful, but usually heals on its own over time.
Is there anything I can do to make it better?
I recommend applying ice to the affected finger to help reduce the swelling and taking over-the-counter pain medications such as ibuprofen as needed for pain relief. In severe cases, the hematoma may need to be drained by a medical professional.
Okay, thank you for letting me know. When can I expect to be discharged?
We can discharge you as soon as you feel comfortable and your pain is under control. I will provide you with a prescription for pain medication and instructions for at-home care.
Thank you, doctor.
You're welcome, Sarah. Before we conclude, I want to make sure you have all the information you need to take care of your finger at home. It's important to keep the affected finger elevated and avoid any activities that may aggravate the injury.
That sounds reasonable, doctor. Should I be applying any ointment or bandages to my finger?
No, it's best to leave the area open to air and avoid applying any ointment or bandages that could cause further irritation. You can cover the affected finger with a clean cloth or gauze to protect it from accidental bumps or injuries.
Okay, I understand. How long will it take for my finger to heal?
The healing time can vary depending on the severity of the injury, but generally, it can take a few weeks for the subungual hematoma to resolve completely. If you notice any signs of infection, such as redness, warmth, or pus, please come back to the hospital immediately.
I will make sure to monitor my finger closely and seek medical attention if necessary. Thank you for your help, doctor.
You're welcome, Sarah. Is there anything else you would like to ask or discuss?
No, I think that covers everything. Thank you for your time and attention.
It was my pleasure. Take care, and I wish you a speedy recovery.
Now, look at the notes for extract 2. Extract 2. Questions 13 to 24. You hear a consultation in GP's office. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning. May I know your name, please?
Hi, my name is John.
Hi, John. Can you tell me your age?
Yes, I'm 50 years old.
What brings you to the hospital today?
I have been experiencing abdominal pain and diarrhea.
Okay, can you tell me when you first noticed these symptoms and how they have progressed?
It started a few months ago as a mild discomfort, but it has been getting worse over time and now the pain is constant and the diarrhea is frequent.
Thank you for that information. Do you have any past medical history?
Yes, I have a history of chronic pancreatitis.
And how about your family history? Has anyone in your family been diagnosed with any illnesses?
My father had pancreatic cancer.
Thank you for that information. Now, do you have any allergies?
No, I don't have any allergies.
Okay, let me do a physical examination. Your blood pressure is 130/90, heart rate is 90 beats per minute, and your temperature is 99.5 degrees Fahrenheit. Based on your symptoms and physical examination, I suspect you may have pancreatic insufficiency. We will need to run some tests to confirm the diagnosis, such as a fecal elastase test.
What's pancreatic insufficiency?
Pancreatic insufficiency is a condition where the pancreas does not produce enough digestive enzymes to break down food in the small intestine. This can lead to malabsorption and symptoms like abdominal pain, diarrhea, and weight loss.
What's the treatment for it?
Treatment involves replacing the missing digestive enzymes through enzyme supplements. We will also recommend dietary changes to help you manage your symptoms and improve your nutrition. In some cases, we may need to address any underlying conditions that may be causing the pancreatic insufficiency.
How long will I need to stay in the hospital?
You may not need to stay in the hospital, but we will need to monitor your progress closely and adjust your medications and diet as needed. We will also do follow-up tests to check your enzyme levels and overall health. Once we determine that you are stable and managing your symptoms well, we can discuss discharge planning and refer you to a specialized treatment program if necessary.
Thank you for explaining the diagnosis and treatment plan to me, doctor. Is pancreatic insufficiency a serious condition?
Yes, it can be serious if left untreated or poorly managed. Chronic malabsorption can lead to malnutrition and other complications, such as osteoporosis, anemia, and neurological problems. However, with proper treatment and follow-up, most people with pancreatic insufficiency can lead healthy and productive lives.
That's good to know. Can you tell me more about the enzyme supplements?
Sure. The enzyme supplements come in the form of capsules or tablets that you take with meals or snacks. They contain pancreatic enzymes such as lipase, protease, and amylase, which help break down fats, proteins, and carbohydrates. The dosage and timing of the supplements depend on your individual needs and the severity of your pancreatic insufficiency.
Will I need to take these supplements for the rest of my life?
Yes, in most cases, pancreatic enzyme replacement therapy, PERT, is a lifelong treatment. However, the dosage and frequency of the supplements may change over time based on your response to treatment and any changes in your diet or health status. We will monitor your enzyme levels and symptoms regularly and adjust your treatment plan accordingly.
That makes sense. Are there any side effects of the enzyme supplements?
The most common side effects of PERT are abdominal pain, bloating, and diarrhea. These usually occur if you take too much of the supplements or if you have an underlying condition that affects your digestive system. We will start you on a low dose of the supplements and gradually increase it as needed. If you experience any side effects, we can adjust your dosage or switch to a different type of enzyme supplement.
Okay, thank you for letting me know. What about the dietary changes you mentioned earlier?
Yes, dietary changes can help manage your symptoms and improve your nutrition. We will recommend a diet that is low in fat and high in protein and carbohydrates. This can help reduce the workload on your pancreas and make it easier for the enzyme supplements to do their job. We will also advise you to avoid certain foods that can aggravate your symptoms, such as spicy, fatty, and fried foods.
I see. Is there anything else I should be doing to manage my condition?
Yes, it's important to maintain a healthy lifestyle and follow any other medical advice or treatment plans we recommend. This may include getting regular exercise, quitting smoking, managing stress, and taking any medications as prescribed. We will work with you to develop a personalized care plan that meets your specific needs and goals.
Thank you, doctor. That's very helpful. When can I expect to hear back about the test results?
It may take a few days to a week to get the test results back, depending on the lab and the specific tests we order. Once we receive the results, we will schedule a follow-up appointment to discuss them with you and adjust your treatment plan as needed. In the meantime, if you have any concerns or questions, feel free to reach out to us.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear part of a conversation between a doctor talking to a patient. Now read the question.
Good afternoon, Ms. Lee. I understand that you're concerned about your weight and have been referred to me because of your obesity.
Yes, I've been struggling with my weight for a long time, and I'm ready to take action to improve my health.
That's great to hear. Can you tell me a bit about your diet and exercise habits?
I try to eat healthy, but I do have a weakness for junk food and sugary drinks. I also don't exercise as much as I should.
That's understandable, but it's important to make changes to your diet and exercise habits to improve your health. Have you tried any weight loss programs in the past?
Yes, I've tried a few, but I haven't had much success. I always seem to gain the weight back.
That's a common problem. It's important to focus on making sustainable changes to your lifestyle rather than quick fixes. Have you considered working with a nutritionist or a personal trainer to help you develop a plan?
Yes, I've thought about it, but I'm not sure where to start.
Now look at question 26. You will hear a part of a speech given by a healthcare professional. Now read the question.
Good afternoon, everyone. Today, I want to talk to you about the role of diet in disease prevention and management. As a registered dietitian, I have seen firsthand how making small changes to your diet can have a significant impact on your overall health. First and foremost, it is essential to understand that what we eat plays a critical role in disease prevention. A balanced diet that is rich in fruits, vegetables, whole grains, lean protein, and healthy fats can help prevent chronic diseases such as heart disease, diabetes, and certain types of cancer. These foods provide our bodies with the essential nutrients needed to function correctly, boost our immune system, and protect us from harmful substances. In contrast, a diet that is high in saturated and trans fats, added sugars, and sodium can increase the risk of chronic diseases. These types of foods are often found in fast food, processed snacks, and sugary drinks. By consuming them regularly, we put ourselves at risk for health problems such as high blood pressure, high cholesterol, and obesity. So, how can we make sure we are eating a balanced diet? The easiest way is to follow a few simple guidelines. First, aim to consume at least 5 servings of fruits and vegetables each day. These foods are loaded with vitamins, minerals, and antioxidants that help fight off disease. Second, choose whole grains over refined grains, such as white bread or pasta. Whole grains provide more fiber and nutrients, which can help reduce the risk of heart disease, diabetes, and other chronic diseases.
Now look at question 27. You hear part of a conversation between a nurse and a patient. Now read the question.
Yes, early treatment with antiviral medication can help reduce the risk of developing postherpetic neuralgia. Additionally, taking good care of the affected area, avoiding stress, and getting plenty of rest can also help reduce the risk of developing this complication.
Thank you for the advice. Is there anything else I should be aware of?
It's important to keep the affected area clean and dry, and to avoid scratching or picking at the rash. You should also avoid contact with people who have not had chickenpox or the chickenpox vaccine until your rash has fully healed. If you develop any complications or have concerns about your symptoms, be sure to contact me or seek medical attention right away.
Okay, I will definitely do that. Thank you so much for your help.
You're welcome. Take care and feel better soon. Now look at question 29. You will hear a part of a speech given by a healthcare professional. Now read the question.
Good evening everyone. I am delighted to be here today to talk about the role of podiatry in foot health and disease prevention. As a podiatrist, I am passionate about promoting foot health and educating people on how to keep their feet healthy. Our feet are the foundation of our body, and they play an essential role in our overall well-being. However, foot problems are often overlooked or neglected, and this can lead to serious health issues. Podiatrists are healthcare professionals who specialize in the diagnosis and treatment of foot and ankle conditions. We are trained to assess, diagnose, and manage a wide range of foot and ankle problems, including diabetic foot care, plantar fasciitis, bunions, heel pain, and ingrown toenails. Prevention is always better than cure, and when it comes to foot health, this is particularly true. As podiatrists, we can play a significant role in preventing foot problems from occurring in the first place. We can do this by educating patients on how to care for their feet properly, and by identifying potential problems early on, before they become more severe.
Now look at question 29. You hear part of a conversation between a GP and a patient. Now read the question.
Are there any side effects to the treatment options?
Some medications can have side effects, but we will monitor you closely to ensure that any side effects are managed effectively. It's important to follow the treatment plan closely to improve your quality of life and prevent complications.
Thank you. I'm willing to do whatever it takes to manage my symptoms and improve my health.
That's great to hear, Ms. Davis. We will also provide you with some tips to manage your symptoms at home, such as taking warm baths to help with your joint pain and using over-the-counter creams to soothe your rash.
That's helpful. How long will I need to take the antibiotics?
The length of treatment depends on how severe your symptoms are and how long you have had Lyme disease. Typically, we recommend a course of antibiotics for 2 to 4 weeks. It's important to complete the full course of antibiotics even if you start feeling better to ensure that the bacteria causing the disease are completely eliminated.
That makes sense. Are there any long-term effects of Lyme disease?
Now look at question 30. You hear a part of a conversation between a healthcare professional and a client. Now read the question.
Good morning. How can I help you today?
Hi, I need a regular dental checkup and cleaning.
Sure, let's take a look at your teeth. It seems like you have some gum inflammation. Do you floss regularly?
Not really, I've been struggling to make it a habit.
Flossing is very important for maintaining good oral health. It helps remove plaque and food particles from between your teeth and gums. Flossing daily can prevent gum disease, tooth decay, and bad breath.
Really? I didn't know that.
Yes, flossing also helps to reduce the risk of heart disease, diabetes, and other chronic diseases. Poor oral health can lead to inflammation in the body, which can affect your overall health.
I had no idea it could be so beneficial.
Yes, it's an easy and inexpensive way to improve your oral and overall health. I recommend using a floss that is comfortable for you and flossing at least once a day, preferably before bedtime.
Thank you for informing me. I'll make sure to make flossing a daily habit from now on.
Great, and don't forget to schedule your next appointment in 6 months for a follow-up checkup and cleaning.
I will, thank you.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1. Extract 1. Questions 31 to 36. You hear an interview with a doctor. You now have 90 seconds to read questions 31 to 36.
Today we're talking to Dr. Emily Nguyen, a pulmonologist and expert in acute bronchitis in the USA. Dr. Nguyen, can you explain what acute bronchitis is and what causes it?
Acute bronchitis is an inflammation of the bronchial tubes, the tubes that carry air to your lungs. It's typically caused by a viral infection, but can also be caused by bacteria or irritants like smoke or pollution. Symptoms include coughing, chest discomfort, and shortness of breath.
How long does acute bronchitis typically last?
Acute bronchitis usually lasts for a few weeks, but the cough can persist for several weeks after the initial infection has cleared up.
What treatments are available for acute bronchitis?
Since acute bronchitis is typically caused by a viral infection, antibiotics are not effective in treating it. Treatment options include rest, staying hydrated, and over-the-counter medications like cough suppressants and pain relievers to relieve symptoms.
Are there any complications associated with acute bronchitis?
In most cases, acute bronchitis is a self-limited illness and does not lead to any serious complications. However, in rare cases, it can progress to pneumonia, especially in individuals who are immunocompromised or have underlying lung disease.
What can people do to prevent acute bronchitis?
The best way to prevent acute bronchitis is to practice good hygiene, like washing your hands frequently and avoiding close contact with sick individuals. Quitting smoking or avoiding exposure to secondhand smoke and air pollution can also reduce your risk of developing acute bronchitis.
Can you share a case study of someone who has experienced acute bronchitis?
Sure. I recently saw a patient, let's call her Sarah, who presented with a persistent cough and shortness of breath. She had recently had a cold and her symptoms had persisted for several weeks. Upon examination, we diagnosed her with acute bronchitis. We recommended rest, hydration, and over-the-counter medications to relieve her symptoms. She recovered within a few weeks and her cough resolved gradually over the next few weeks.
What advice do you have for individuals who may be experiencing symptoms of acute bronchitis?
If you are experiencing symptoms like coughing, chest discomfort, and shortness of breath, it's important to seek medical attention to rule out any underlying lung conditions or complications. Rest, staying hydrated, and over-the-counter medications can help relieve symptoms, but it's important to follow up with your healthcare provider if your symptoms persist or worsen.
Thank you, Dr. Nguyen, for the insightful information on acute bronchitis. Can you tell us more about the diagnostic process for acute bronchitis?
Sure. A diagnosis of acute bronchitis is usually made based on a patient's symptoms and medical history. A physical exam may also be performed to listen for abnormal sounds in the lungs. In some cases, imaging studies like a chest X-ray may be ordered to rule out other conditions like pneumonia. If there is concern for bacterial infection, a sputum culture may be obtained to identify the specific bacteria causing the infection.
Can you tell us more about the role of cough suppressants in treating acute bronchitis?
Cough suppressants can help relieve the symptoms of acute bronchitis by reducing the intensity and frequency of coughing. However, it's important to note that coughing is a natural reflex that helps clear the airways of mucus and other irritants. Therefore, cough suppressants should only be used as directed and for a limited period of time, as prolonged use can lead to the buildup of mucus in the airways and increase the risk of developing pneumonia.
What about the role of expectorants?
Expectorants are medications that help thin and loosen mucus in the airways, making it easier to cough up. However, there is limited evidence to support the use of expectorants in the treatment of acute bronchitis, and their effectiveness is variable. Therefore, their use should be guided by a healthcare provider.
Are there any alternative therapies or home remedies that can help relieve the symptoms of acute bronchitis?
Yes, some people find relief from alternative therapies like acupuncture or herbal remedies like eucalyptus oil or honey. However, it's important to note that these therapies have not been rigorously studied and their effectiveness is not well established. It's also important to speak with a healthcare provider before trying any alternative therapies or home remedies, as some may interact with other medications or have adverse effects.
Thank you, Dr. Nguyen, for the helpful information. Do you have any final advice for our audience on how to manage and prevent acute bronchitis?
My final advice would be to take steps to protect your respiratory health, like quitting smoking or avoiding exposure to secondhand smoke and air pollution. It's also important to practice good hygiene and to seek medical attention if you experience symptoms like coughing, chest discomfort, or shortness of breath. Early diagnosis and treatment can help prevent complications and promote a faster recovery.
Now look at extract 2. Extract 2. Questions 37 to 42. You hear a talk given by a healthcare professional. You now have 90 seconds to read questions 37 to 42.
Good afternoon, ladies and gentlemen. I am honored to be here today to speak to you about a topic that is vastly important and that affects millions of people worldwide. Today, I would like to talk to you about hepatitis B, a viral infection of the liver. Hepatitis B is a significant health concern, with over 290 million people worldwide suffering from the disease in 2019. The virus is spread through blood and bodily fluids, and it can lead to both acute and chronic liver disease. While the acute form generally lasts less than 6 months, chronic hepatitis B can last a lifetime, resulting in scarring of the liver or even liver cancer. The prevention and treatment of hepatitis B are therefore paramount in eradicating this disease. Let us first talk about modes of transmission. While hepatitis B is not considered a foodborne illness, it can still be transmitted through contaminated needles, transfusions, and body fluids such as semen and vaginal secretions. This makes it a disease that is more commonly seen in high-risk groups such as those who engage in unprotected sex with multiple partners and those who use intravenous drugs. Additionally, infants born to mothers infected with hepatitis B can often become infected themselves. Vaccines against hepatitis B exist, and they have been shown to be effective in preventing the disease's transmission. It is critical that individuals at higher risk be screened for the disease early to prevent the virus's spread. When we diagnose hepatitis B, it is essential to understand that the disease may not always manifest itself. Acute hepatitis B may present with flu-like symptoms such as fever, muscle aches, nausea, and vomiting. However, in many cases, the symptoms can go unnoticed and be interpreted as a mild cold. Chronic hepatitis B, on the other hand, can potentially be asymptomatic, whereby the patient may not show any symptoms until there's already chronic liver damage. For this reason, we recommend regular medical checkups, such as a liver function test, to prevent patients from unknowingly suffering from the chronic form of the disease. Once a patient has been diagnosed with hepatitis B, prompt intervention methods can be implemented to prevent further spread of the virus. Medications are available to treat chronic hepatitis B, and they have been shown to be effective in suppressing viral replication in the body, slowing the progression of liver disease, and reducing the risk of eventual liver cancer. However, it is important to note that hepatitis B is not curable, and the objective of treatment is to protect the liver from further damage, which can be achieved with lifestyle modifications such as abstaining from alcohol, avoiding fatty foods and certain medications. and getting vaccinated against other forms of viral hepatitis to further reduce the burden on the liver. I would like to stress the importance of vaccines in preventing the spread of hepatitis B. A vaccine that targets hepatitis B has been available since 1982, and the widespread implementation of vaccination programs worldwide is prompting significant breakthroughs in public health care campaigns. We recommend that all infants receive the vaccine within the first 24 hours of birth, followed by a minimum of 2 more vaccinations. Additionally, all individuals at high risk of contracting the disease should be vaccinated, including healthcare workers, those with kidney failure, individuals who live with or otherwise frequently come into contact with those carrying the virus, and those traveling to countries where hepatitis B is prevalent. To further illustrate the importance of early detection and intervention, let me share with you a detailed case study of a patient I recently treated. Mr. Smith, name changed for privacy, is a 44-year-old man who presented to our clinic with flu-like symptoms such as fever, chills, and body aches. Upon examination, we found elevated liver enzymes in his blood work, prompting us to conduct additional tests, including a hepatitis B panel. Mr. Smith had never been vaccinated against hepatitis B, and we found that his hepatitis B surface antigen and viral load were both positive, indicating he had acute hepatitis B. We immediately started Mr. Smith on antiviral medication, and he responded well, with a gradual restoration of his liver function. We also recommended lifestyle modifications and counseling to avoid behaviors that could exacerbate his condition, such as alcohol consumption and engaging in unprotected sex. Regular follow-up appointments for liver function tests and viral load monitoring have been scheduled to ensure that Mr. Smith remains on track with his treatment. Research in the field of hepatitis B is ongoing, with a focus on developing more effective treatments and a possible cure. One area of significant research is therapy that targets the host cell, which can interfere with the virus's life cycle and lead to a potential cure. Additionally, there is ongoing research into new therapeutic targets, with clinical trials ongoing to test new treatments such as RNA interference and gene therapy. In conclusion, hepatitis B is a significant health threat that requires early detection and intervention to prevent further spread and potential lifelong effects. Vaccines are critical in preventing the disease's spread, while early diagnosis and proper management can help slow the progression of liver damage. Ongoing research in the field provides hope for potential cures and more effective treatments in the future. Together, we can fight hepatitis B and make a difference in public health worldwide. Thank you.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.